Bwana Yesu asifiwe. Okay. I thank Daktari for inviting us and giving us this opportunity. First, let me give you our names. My name is Joseph Kiarie from Kenya. How many are from Kenya? By maybe a raise of hand. That's good. So maybe when I talk of the healthy system that we are having, you can resonate. And even if you are not from Kenya, you are from Africa, you are from Canada, we are teaching today. The sermon that we end, in fact, was very real to the things that are happening. You plan many things. You plan so many things for your life, but then you don't plan to get sick. Praise God. Do you plan to get sick? Do you plan to get sick? Let's be interactive. Sawa sawa. For those ones who understand, please let's be interactive. Now, we are Social Health Authority. Initially, it used to be called NHIF, National Hospital Insurance Fund. Today, you are very healthy, like Kiarie, who is speaking. Tomorrow, or maybe in the evening, you are sick. The wealth that you earned that particular time when you are okay, you are going to utilize the same so as to regain your health. Praise God. Am I speaking to somebody? Now, here, probably you have a very elaborate healthy system. You may be traveling back home, and as we have started, you don't plan when to get what? To get sick. Sickness can occur anytime and anywhere. Alternatively, you have your loved ones who are back in the country. Your siblings, your parents, they may get sick. Who is going to assist them? They actually look upon you to assist them. You send so much money so that then they can be assisted. But if you have an elaborate plan, that one can work. You just pay so much retro, and then those people are covered. Are we together? Are we together? Because we say a healthy nation is a what? Sorry? A healthy nation is a? Now, here in Canada, your healthy system is very elaborate. You just walk in and walk out. Because the government has taken care of that healthy system. That's why you get to see developments are all over. Because you don't think about financing health. Now, back at home, our people are suffering. Daktari talked about this sickness. When you talk of cancer, when you talk of diabetes, when you talk of dementia, there are quite a number. There are so many other illnesses, lifelong. They need to be managed. And when we talk of management, it requires a lot of funds, a lot of funding. Whatever investment that you want, you drain them within a day or two. But then if you are going to pull these resources together, today you pay just so retro. I think it's about 300 to 500 Kenyan shillings. How much is $1 Canadian? Sorry? About 91. So if we can pull those resources, every month you pay something small. we come up with a system whereby you are registered, and then we'll be able to help those people back at home. You are assured that they are not going to come to you asking for those assistance. But you can help them. You can help them knowing that the healthy system is catered for. They just walk to the hospitals, they walk back, and then they continue with the building of our country. Praise God. Those at the back, can you hear me? Are we praising God together? God is love. So that is what we have been told. That is the teaching of today. Mene mene tekel. That is what you are told. Gauge your actions now. Whatever things that you do are going to count tomorrow. And know that the Lord is watching. So if you do something good for your brother, and who is your brother? The person who is in need. Okay? If you do something good, you are going to be rewarded. But if you do something that is not okay, still there is a punishment. I think that is the teaching for today. If at all you are keen to listen. Now, so far so good. We do register, we have the cans, and then you present those cans in the hospital. Okay? Let me introduce my colleague, Dr. Firis, to just lap up. In case of any questions, please, we are ready to answer those questions and assist you on the way forward. Praise God. Karibu, Daktari.
Praise God. We said how many are from Kenya? And the rest are from where? How many are from Africa? Originally? Various continents, eh? So basically it's just to talk about the importance of health insurance and basically just having a form of payment in case you get sick. So definitely in the developed world, everything is sorted. Sindio? Here everything is sorted, eh? But yeah, back home not everything is sorted, but we are getting there. And the World Health Organization has pushed every country to ensure they achieve universal health coverage. So basically everybody must access health care. So every country is working towards that, including Canada. And every country is at its own path and pace towards UHC. And I know most of the African countries, there's much more to do. And let me not lie to you, even Canada has some work to do. Sindio? It's not all perfect. It's only perfect in heaven. So Kenya has been doing quite a lot. They'll give you your story, their story. If you go to South Africa, they'll give you their story. If you come to Canada, they'll give you their story. And every story is different, depending on the people, depending on the cultures, depending on the politics, yeah? And depending on the beliefs. So I've been to Rwanda, and I went to study issues to do with UHC, and just to understand their path, because I know they're doing very well. And we realized that they have their own path. And Kenya also has its own path. So as much as we were admiring them, they're also admiring us as Kenya. So everybody has their own journey. And what is most important is the Bible, I think, says, love yourself. Love your neighbors, you love yourself. Sindio? See, that is true. So if you love yourself, then you make sure that you're covered, you have medical access, because the body is the temple of the Lord. So if you really, really take care of yourself, now let's think about the neighbor that you love as much as you love yourself. That is your mother, that is your sister, that is your sibling, that is your, back home, the people you've left back home. So do they have a form of access to healthcare? That is the question I want to pose to everyone. Are they as good as you are? I know the world is moving away from people taking care of family, but remember, family is the core at the end of the day. As the world progresses, I know everybody wants to take care of their own bills. They want to sort themselves out. But I remember, again, I know that you're handling a lot of requests from back home. Oh, I'm sick. Oh, I have this send some money, I need to undergo a surgery. So that is why it is very important that you, as people start asking you for money back home, just ask them if they have a social health insurance agency and just pay to that. It's much cheaper. Like for Kenya, it's like, I think the list could be less than three Canadian dollars. Is that right? Conversion. 300 Kenya shillings, if you're converting that to per month. That is what the current president had brought in. So most of the people you're assisting in the village, if you're assisting someone, it means they are not able. Definitely, you are not paying for someone who is working. So the ones who are being assisted, my cousin, my grandma, who has no means, definitely it will be 300 Kenya shillings. That could be like, if I'm not wrong, if my conversion is right, is averagely 3 Canadian dollars? Yeah, thereabout. So imagine if you pay, because by law, you pay for 12 months. But from there, all the conversation you'll be having is, are you guys okay at home? Because no one is going to call you to ask you about taking care of them in terms of health. So that is why it is very important to just think about it. And if anybody calls you to ask you about money for surgery, the thing is, let me pay for you. Let me pay for you, go find out, give me the information, let me pay. And if, like for Kenya, you can pay, I can see M-Pesa works from here. So you can pay directly from here, you don't even have to send money. So probably the thing you'll send is transport to the hospital, so that at least they can be able to be taken care of. I'll give you an example of my grandmother, who is always in hospital. She's 85, but she's always in hospital because she has her medical cover, her social health insurance cover. So anytime she feels bad, at 85, I'm sure you know, even a little work, you get tired, you feel pain. I mean, I'm just imagining how it is at 85. So any pain she has, and I think her life has elongated because of, she's able to have that access to a hospital well paid for, and anytime she's unwell, there's no asking for money. The only thing, she has her own tea, she can get her own bonus, so she doesn't have to ask for money in terms of health, and that elongates her life. So think of your parents back home, if they are not in this country. Think of your cousins, your relatives. Encourage them to have a form of insurance, health insurance. Encourage them to, if you're rich enough to pay cash, then that is well. But remember this thing, you can go to hospital and the bill is, it starts as you're told to pay some amount. Maybe let's say, you can be told to pay, I'm trying to convert in my head. You can be told to pay like $700 when you're admitting somebody. But by the time they're leaving, it can spiral to an amount you can never imagine. You probably have to sell your house. And remember, that is your mother, that is your brother, that is your sister, so you can't abandon that responsibility. So the question I want you to ask yourselves in your heart, the people that I am taking care of, my parents, my siblings, do they have any form of insurance? And if they don't, it's not a must. If you have cash, if you're rich, then well, you'll pay the bill, there's no problem. But if you're not, then peace of mind is very necessary, and you can encourage them to enroll. An example for Kenya is that it's mandatory, it's a must. As long as you're over 18, you must register, and you must access. By force, you have to go to hospital. And the government has that role. Yeah. Let me explain. So the question is if this is different from the National Health Insurance Fund. So it was the National Hospital Insurance Fund. That act, the Act of Parliament, is the one that makes that exist. So it was repealed by law, and from that time we had National Health Insurance Fund. This is all a journey towards UHC. As I said, every country is different. So come last year, it was again repealed by law. So the national NHIF does not exist. It stopped existing last year in November 2023. A new act was put in place. The Ministry of Health, under the guidance of the President, implemented four acts in government, all towards health. As I said, this is all a journey. And remember, all this is not, it's not something that this country is only doing. If you look at other countries, everybody is doing their own things to align to that. And these are just examples from other countries. So right now we have the Social Health Authority for Kenya. It's not called NHIF anymore for the people from Kenya. It is called the Social Health Authority. So NHIF is no longer there. Anybody over 18 years, yes, by law, by law. Yes, you have to. It's contributory. Only in government hospital in Kenya. And not in government hospital, in a hospital in Kenya. Not beyond borders. Beyond borders, you just have to, yeah, not within the country, yes. Yes. If you choose to go to the top range hospitals, Nairobi Hospital, Aga Khan Hospital, you co-pay. And most of the people who go to, especially Kenyans, who are or residents, because now this current law talks about residents. It doesn't talk about Kenyans. Anybody residing in Kenya. So if you choose to go to Nairobi Hospital, you will co-pay with your current insurance. So it is assumed you have a private insurance. And most of the people who go to Nairobi Hospital have a private insurance. So it's co-paid, yeah? So half will be paid, our quota will be paid by NHIF, Social Health Authority, then the rest is paid by your insurer. But what is happening is that most of these private insurance are pushing the bills to the government. So if you don't have, and by law you should have, if you don't have the SHIF, Social Health Insurance Fund, the card, then it means that the private insurance will pay a bit and leave the rest for you to pay cash.
But whoever who doesn't have private insurance, then basically they need to go to the government.
Yes, so we have comprehensive and non-comprehensive hospitals. We have comprehensive and non-comprehensive hospitals, depending on the contract they sign. So most of these hospitals, the government hospitals and the private hospitals and the mission, government, you know, there's SDA hospitals, there's Catholic hospitals. Those are comprehensive. So you walk in, walk out. But if you choose to go to Nairobi Hospital, Aga Khan, MP Shah, those ones you have to co-pay. So if you go for the top range, definitely you have to co-pay. So most of the people, if you look at, it's not like here where everybody goes everywhere. So this one is just the scales of what is in your pocket. So if you have the money to walk to Nairobi, you willingly walk to Nairobi knowing that I can afford Nairobi Hospital. But the Social Health Insurance Fund will pay to a level. Then the rest is either cash or the rest is either. But for this one, where I would say it is better than what was there, as I started by saying, this time they passed 4 laws. One of them is called the FIF law, where the money that is now collected by the Social Health Insurance Fund, whatever people will be paying will be collected. And as it is being paid to counties, the money by law now is being ring-fenced strictly for hospitals. It is channeled back directly to hospitals. Initially, we would pay in claims, we would pay government hospitals, but they would take the money to roads, depending on the governor. So someone will decide in my county, yes, I received from NHIF, let's say 30 million Kenya shillings, but I'm not going to take it back to health. I go and do a road. So you see that would now affect. But from other counties that had done very well, you now can walk into a government hospital and you can do brachytherapy if you have cancer, You can do kidney dialysis if you have kidney failure, and that is government. But now, based on that example of the other counties, they have created a law. If today Social Health Authority pays your county 10 million, that money must go back to health. So basically what we're going to see, hospitals are going to improve. Government hospitals are going to improve in terms of medication, in terms of machinery, in terms of equipment, in terms of even payment of salary. So definitely give it a year or so. And that is why we need to onboard everybody. Everybody has to be onboarded because it's a power of numbers. It's a social health insurance. So it's a matter of numbers. So if only a few people are contributing, then it means there's no money coming in. If there's no money coming in, then the quality of healthcare will not be as good.
Okay, so the one you're advocating is the social health insurance, if I'm repeating the
Yes,
authority.
yes.
And how much per person again?
$3. I'm
Per month.
converting, yeah, per month for the poorest.
How is it categorized then?
So now they've created, and now statisticians have come in. So they've created a tool that when you're registering, you enter. So they ask you, what do you do? How much do you earn? And what do you own? Do you have these cows? Do you have this cattle? Do you have what? Do you have land? What do you do? Then now for the people who are formally employed, it is 2.75% of your gross salary. Comes without saying, that is a standard. But for the informal sector who now have their businesses running, then we look at, if I'm a person who does what? Like transport business, I'm at Boda Boda, the motorcycles that take people around. And I have 100 motorcycles, I cannot pay $3. So they do the means testing, they're calling it means testing, and it's provided for by law. So once you do your thing, then down there it tells you now, based on what you are, you discover you're rich, and you were thinking you're poor. So it depends on your, and this data, once you've done your own self-evaluation, then the government, KRA, Kenya Revenue Authority, has all your details, so you cannot lie. So based on that, so when your relatives now are approaching you, and most of these people in the village, if they're doing nothing, they'll end up paying $3. People who are students, because there are people who are students in college that maybe you're supporting your sister's kids, most of them will pay $3. So the people who have a means of getting in money are the ones who are going to pay more. So basically, so that is all towards UHC, and every country has its own story, as I started by saying. But for us in Kenya, we get a lot of African countries coming to benchmark. We have a lot of people coming to see what we are doing, believe it or not. So because basically the challenge would be registration numbers. People just come, they consume, and they drop out. People come, they consume it. The only people we get in our database that are constantly there are the ones who have chronic illnesses. And I think yesterday online we were talking about that. So if I have kidney failure, where am I going? You can't drop off, so you have to pay. So you're tied by the disease. If I have oncology, if I have cancer and I need to do chemotherapy, where do I go? So we realized that most of the people in the database, and it was so bad that you realize that maybe somebody who's paying you $5 is consuming $500. So you pay today, 60 days later, we pay for you $500. So where does the money come from? Yes, you've not been paying, you've come in, it has a name, whereby you adverse selection. You come in sick. Insurances don't pick sick people. See, that's it. You remember even when you're doing your car insurance, they ask you, have you ever had an accident? They look at it, I don't know how it is here, but they look at if they realize you're someone who drives crazily, then definitely your interest rate goes higher because they will pay you after a month, after you paying. So it's the same thing with health insurance. Most private insurances will even look at if you have a disease. If you have diabetes, they give you higher premiums. Nowadays, they don't send people away anymore. So they realize, oh, you're a liability. Come. But this is what you're going to pay. When you look at the bill, it's quite expensive. If you're older, they will charge you more interest rates. But if you're coming in and you've been paying and you have a good history, and that's where we are going. If you have a good history and you've been consistently paying, and we don't know, today you're okay, tomorrow your kidney is failing, and